Please proceed.
Thank you. Tonight I'm going to be speaking to you about the historical work of a Canadian dentist by the name of Dr. Weston A. Price and his groundbreaking book, Nutrition and Physical Degeneration, which can be read for free on the Gutenberg Press website. And his book basically shows, through all of his research, is that cavities are not caused by a fluoride deficiency, rather they are caused by malnutrition. And what most people don't know is that cavities are new to humans. They only began appearing in humans back about 10,000 years ago after we invented agriculture. And this is an era where we started displacing animal foods and started replacing them gradually with more plant-based foods, which are nowhere near as nutrient-dense as the animal foods. And in a statement last year, Dr. Brian Orszewski said that 15% of our children are not getting cavities, but that means, tragically, that 85% of our children are getting cavities. And considering the fact that cavities are new to humans, we shouldn't be experiencing tooth decay at all. How is it possible for someone to say that fluoride is effective when 85% of our children are getting cavities?
Yeah! Yeah! Woo!
Now let's imagine in the 1800s, the general store didn't have much for food whatsoever. It was an era when many of us still lived on farms, or we had access to farm fresh foods. So the bulk of our calories would have been coming from pastured chicken, pastured eggs, pastured pork, pastured beef, pastured dairy products. We didn't have access to all of the newfangled foods that we see lining our grocery store shelves today. Tens of thousands of these nutrient-deficient processed foods that are not sustaining human health whatsoever. And I'm not the only one who says this. The World Health Organization in 2003 wrote this report, this seminal report saying that processed foods are causing cancer, heart disease, diabetes, and obesity, which is costing our healthcare system billions of dollars every single year. Yet public health hasn't put warning labels on these foods, and they deserve warning labels. And here we see the increase in sugar consumption, another newfangled food in our food supply. In the 1700s, we only eat about 4 pounds of sugar per year. Today, we eat about 150 pounds of sugar per year, and we know that sugar causes tooth decay. And here is the Journal of Dental Research saying that children with the best dietary practices were 44% less likely to exhibit severe early childhood caries compared with children with the worst dietary practices. And it was because of the children that Dr. Weston A. Price set out to do his research back in the 1920s and 30s. What he noticed was, in his child patients, is he started to see several cavities in his children for the first time. Now, he was treating the parents of these children, and the parents, it was rare to see any cavities in the parents whatsoever. So he was very curious as to why suddenly, in one generation, he started to see outbreaks of dental caries. So what he did was he traveled around the world visiting several countries, and he examined the diets of many different cultures, and he compared their diets with their overall health and their dental health as well. Now, he took hundreds of pictures in several different areas of the world, and I'm only going to show you a couple of examples. One in the South Pacific, and now the teenage boys that he took pictures of in this village. What he noticed in this village was that dental cavities were extremely rare. They had beautiful teeth, they had straight teeth, and overall excellent health, and their diet did not include any of our modern westernized, industrialized foods. They ate their traditional diet and basically enjoyed overall health because of it. And then when he visited neighboring villages and tribes, what had happened was where they were importing modern foods, he also noticed rampant tooth decay and modern diseases. So you see the dramatic differences in terms of their oral health from one tribe or village to another. And here he runs into, in this case he was off the Scottish coast, and he met these two brothers. The one brother had excellent dental health, and he had maintained his primitive diet. The other brother had rampant tooth decay, and he had begun eating modern foods like white bread, jam, highly sweetened coffee, and sweet chocolates. And his father complained that this brother also had trouble getting out of bed in the morning. And another observation by Dr. Weston A. Price was that the senior citizens did not need false teeth, that they were able to retain all of their teeth, many of them to an old age. And there were several components of a healthy diet, one of them being, of course, that they did not eat industrially processed foods, that a large majority of them had emphasized healthy fats like butter, meat, and egg yolks in their diet. These are the foods, unfortunately, that we are told to stay away from. And there's too much at stake. I'm just going to finish up by saying, considering how sick our children are today, and the fact that an astounding 85% of them have cavities, rather than adding a chemical to our water supply, it's clear that our time and money would be better spent protecting them from industrially processed foods. Thank you so much.
Yeah.